Hi, this is Dr. David Stevens. I'm a board-certified plastic surgeon in Bellevue, Washington. This is our Vectra 3D imaging system. We found it is very successful in allowing our patients to see what their results might look on them. Our patient had a base width diameter of 12.5 centimeters. So on the right side, I chose a breast implant that fit within that frame. This implant is about 12 centimeters wide, whereas on the left side, the implant is about 14 centimeters in diameter. Most of us in plastic surgery would want the base width of the breast implant to fit within the base width diameter. And so it's all about the width. So if you look at the left breast and you look at the right breast, the bigger implant on the left is wider than the implant on the right. That's the only difference. There's really not much difference in the profile of these two implants. In showing the implant profile on the left side, there it is on the right side. The only difference between these two breasts is the width of it. There's very little difference in how far they project one to the other. When we decide on the patient's breast size, we want to look at her base width, base diameter of her breast, and fit the implant within it so that there's a nice natural result for her. This is our patient who has almost perfect shape to her breasts. If you look at her breast, inside of the breast sits about here, the outside out into the axilla. The outside of the breast should sit about right here, where we want the implant to go. If you look in this case, the base width fits her breast nicely and it simply goes out into the armpit, whereas over here, it's way out into the armpit more. So there's a limit in terms of how wide we can make that breast. The smaller breast implant here is narrower, and the larger one is wider. That's the simple difference between the two of them. If you look at it from the side view, there's very little difference in projection. The wider is taller, the narrower is not quite as tall, but they don't project much different from one to the other. So when we size breast implants, we're really looking for the base width. What's the best fit for her breast? What's just right? We like to say there's a Goldilocks syndrome in breast implants. There's not ones that are not too big, not too small. What's just right? Now with that said, some of our patients may want a fuller implant than others. We may want to go a little bit wider for them, but we don't want to go so wide that the implant now looks ridiculous. It's now sitting in her armpit and way up on her collarbone. There truly is a right fit for every woman.